Welcome to AG Medicine channel. Today I discuss management of PPH. So, before going to discussing about the PPH, you will want to know what is PPH. This first P indicate post and this P indicate partum and this H indicate hemorrhage. So, PPH indicate postpartum hemorrhage. Post mean after. Partum mean delivery. And hemorrhage means bleeding. So, the postpartum mean after delivery bleeding. So, when the bleeding is occurred after delivery, that is called postpartum. But there is one question. In every childbirth process, there is bleeding is occurred. So, the proper definition is in normal delivery, when more than 500 ml bleeding is occurred from genital tract during childbirth up to end of puerperium. So, in normal delivery, when more than 500 ml bleeding is occurred from genital tract during childbirth up to end of puerperium. But in cesarean section, bleeding amount more than 100 ml, and in hysterectomy, the bleeding amount is more than 1500 ml. So, I think you all are understood what is postpartum hemorrhage. And during the postpartum hemorrhage, pulse rate increase and BP is decrease. Now I discuss type of PPH. According to amount, PPH are three. First, mild PPH. When bleeding is occurred less than 1000 ml, that is called mild PPH. Next, moderate PPH. When bleeding is occurred 1000 ml to 2000 ml, that is called moderate PPH. Third, that is severe PPH. When bleeding is occurred greater than 2000 ml, that is called moderate PPH. So, according to amount, PPH three types: mild PPH, moderate PPH and severe PPH. But according to duration, PPH two types. First, primary PPH. Second, that is secondary PPH. What is primary PPH? When the PPH occurred within 24 hours after delivery. And what is secondary PPH? When PPH occurred after 24 hours after to 42 days, that is called secondary PPH. This primary PPH also divided in two types, that is third stage PPH and second is true PPH. What is third stage of PPH? When PPH occurred before delivery of placenta. And what is true PPH? When PPH occurred after delivery of placenta, that is called true PPH. So, according to duration, PPH is two type. One is primary PPH and second is secondary PPH. What is primary PPH? When the PPH occur within 24 hours, that is called primary PPH. And this primary PPH also two types, that is third stage PPH and true PPH. Third stage PPH is when the PPH occur before delivery of placenta. And what is true PPH? When the PPH occur after the delivery of placenta. And the other types of PPH is secondary PPH. So, when the PPH occur after 24 hours to 42 days, that is called secondary PPH. I think you all are understood about the what is PPH and types of PPH. Now, I discuss today's main topic, that is management of PPH. So, let's discuss about the management of PPH. First, I will discuss third stage management of PPH. So, when the PPH or bleeding is occurred before the delivery of placenta, how we will manage in this situation. In the case of PPH we will manage the PPH according to conditions of uterus. If you feel uterus is hard or firm, there is 20% chance this PPH is occurred due to any traumatic condition. In this, you can exploration of uterovaginal cord. Then you can perform homeostatic suturing. But when you feel the uterus is soft, there is 80% chance this PPH is occurred due to tonicity. In this condition, you massage the uterus. After massaging the uterus, if you feel the uterus is soft, you can give injection oxytocin. When you give this injection oxytocin through IM, you can give 10 international unit. But when you give this injection oxytocin through IV, you can give 20 international unit in 1 liter NS or RL, and flow rate is 60 drops per minute. After giving this injection oxytocin, you need to check the placenta is separate or not. If the placenta is separated, in this condition, you can perform fundal pressure or control cord traction. But if the placenta is not separated, you can perform manual removal of placenta. So in third stage PPH management, if you feel the uterus is hard or firm, you can perform exploration of uterovaginal cord, and after that you can perform the homeostatic suturing. But if you feel the uterus is soft, you massage the uterus, and after massaging of uterus there is two conditions. One, uterus become feel soft, or uterus become feel hard. In this case, when you feel the uterus is soft, in this condition you give the oxygen, you give the oxytocin, and when you give this oxytocin through the IM, you can give 10 international unit. But when you give this oxytocin through the IV, you can give 20 international unit in 1 liter NS or RL, and the flow rate is 60 drop per minute. After that you can check the placenta. You can check this placenta is separate or not. If the placenta is separated, fundal pressure or control cord traction can be performed. But when the placenta is not separate, you can perform the manual removal of placenta. And after massaging of the uterus, when the uterus feel hard, you directly check the placenta is separated or not. If the separated, same thing is performed. If not separated, you can perform the manual removals of the placenta. So I think you all are understood about the third stage PPH management. Now I discuss the management of true PPH. What is true PPH? I already discussed when the bleeding is occurred after the delivery of placenta, that is called true PPH. So when the bleeding is occurred after the delivery of placenta, how we will manage in this condition? First, we will assess the uterus. If you feel uterus is hard or firm, you can perform exploration of uterovaginal canal. After that, you can perform homeostatic suturing. But when you feel uterus is soft, boggy or relaxed, you should perform massaging of uterus. After massaging of uterus, you also feel the uterus condition. After massaging of uterus, you can check the uterus condition. If uterus is hard, that means bleeding become stop. But when the uterus feel soft, that means bleeding is continuing. So for that, you can give injection oxytocin. And when you give this injection oxytocin through IM, you can give 10 international unit. But when you give this oxytocin by IV, you can give 20 international unit in 1 liter NS or RL. And flow rate is 60 drops per minute. After giving this oxytocin, two conditions can occur. One is bleeding stopped. So this case will be managed. But when the bleeding is continued, in this condition you can perform uterine tamponade. After performing uterine tamponade, maybe bleeding stop. But yet bleeding is continued. For that case, you can perform ligation of utero-ovarian artery. This procedure, also called B. Lynch brace procedure. After ligations of uterine artery, bleeding may be stopped. Bleeding stop. But yet bleeding is continued. In that cases, you can perform the last procedure, that is hysterectomy. Hysterectomy means surgical removal of uterus. So this is the last stage to manage true postpartum hemorrhage. So I think you all are understood how to manage true postpartum hemorrhage. For better understanding, I quickly recap the management of true postpartum hemorrhage. True postpartum hemorrhage means when the hemorrhage is occurred after delivery of placenta. In that condition, you will assess the uterus condition. If you feel uterus is hard or firm, in that condition, you can perform explorations of uterovaginal canal. What is explorations of uterovaginal canal? In this procedure, surgeon look inside the uterus. After looking inside the uterus, homeostatic suturing is performed. By this homeostatic suturing procedure, you control the hemorrhage by attachment and compression of hemorrhage site. But when you feel the uterus is soft, boggy or relaxed, in that condition you will massage the uterus. After massaging the uterus, if you feel the uterus is hard, in that condition bleeding will be stopped. But after massaging the uterus, if you feel uterus remains stopped, that means bleeding is continuing. For that cases, you will give injection oxytocin, and if you will give this oxytocin by intramuscular, you will give 10 international unit. But you will give this oxytocin by IV, you will give 20 international unit in 1 liter NS or RL, and the flow rate is 60 drops per minute. After giving this oxytocin, two conditions can be occur. One, bleeding can be stopped. But when the bleeding is continued, in that condition, you can perform uterine tamponade. By uterine tamponade, you can control bleeding by compressing the bleeding vessel. After performing this uterine tamponade, bleeding may stop, means case will be managed. But if the bleeding is continued, in that cases, you can perform ligations of utero-ovarian artery. In that cases, from which artery or from which blood vessels bleeding is continued, you can ligate this artery or you can ligate these blood vessels. This procedure you also call B. Lynch brace procedure. After performing this procedure, bleeding may stop. But if yet the bleeding is continued, there will be remaining only a last procedure, that is hysterectomy. What is hysterectomy? That is surgical removal of uterus. Now today's topic is end. I think you all are understood about the PPH and management of PPH. Thank you for watching my video, and please share, subscribe my channel.